Okay, this is Michael from Blue Sky Bio. I'd like to welcome everybody who's joining us for tonight's webinar presentation. As usual, please complete the webinar attendance form so we can send you the CE credit that will arrive via email within around 1 week after the webinar presentation. And if you have questions during the presentation, please enter them into the chat box and we'll try to address them as we go along. Tonight's presenter is Dr. Cory Glenn. I think at this point of time, he doesn't need much of an introduction, but he's joined the Blue Sky Bio team, the clinical director of technology, and we're very happy to have him aboard. And I think the main problem for tonight is he has too much to discuss. There's been a lot going on at Blue Sky Bio, a lot of new updates and functionality with the software. So it's very exciting times. And tonight we're hearing Dr. Cory Glenn present on the topic of digital denture, completely in-house. Cory?
All right. Well, thank you for the introduction. I think this is my fourth one of these, and they've all been 1-hour lectures that went around 3 hours. So maybe I can beat that tonight. We'll see. I'm not making any promises, but yeah, this is something I've really been working a lot on lately, actually for probably the last 8 to 10 months, very closely with Michael and the whole team, and really proud of what we've come up with and really what's still yet to come. I think this is as big of a breakthrough in anything that's happened in dentistry in quite some time, to be quite honest. So let's just jump right into it because I got a lot of ground to cover. So I want to first present to you what the denture dilemma is. So I want you to imagine for a second, Dr. Doe, he practices in a real poor rural area of West Virginia. Lots of patients that really need dentures that, are not the best off economically. So Dr. Doe is participating in numerous PPOs. He participates in the state Medicaid program. And so as any practicing dentist knows that accepts any of those, you might have a fee of $1,400, but that doesn't mean anything as far as what you're actually going to get paid. So let's suppose that he's only reimbursed on average about $700, and he's not able to balance bill, meaning he can't charge the patient the balance remainder of that. And so Dr. Doe is just going to get $700 for this denture. And let's also suppose that he's still making dentures the traditional way that we were most all taught in dental school, which is 5 appointments. Let's say that those are 30 minutes a piece. So 2.5 hours invested in this process to generate a denture. And then he's going to have a very typical lab B. This is not an outrageous lab B fee whatsoever. Let's say it's $300 an arch. Actually, my lab bill for a complete denture was higher than that. And let's just say that he has a $100 an hour overhead. I know that my practice was significantly higher than that, but let's assume since he's in a rural area that he's got low operating expenses. So the situation that Dr. Doe finds himself in is that he's getting $700 of reimbursement for this denture, and he's automatically losing about $300 of that in the lab bill. No fault of the lab, it's just the nature of the beast. These are just a labor-intensive service to provide. And so he's only left with about $400 of remaining profit. And when he subtracts out the $250 for his overhead and labor, he's down to $150 of net profit on this case. And that's a procedure that took him 2.5 hours at best. That's assuming that there's no remakes or resetting of teeth. And at worst, let's assume that there was a reset of the teeth and more associated lab bills. Or let's assume that like 80% of full denture patients, they're unhappy and they're complaining and they're in 15 times for adjustments, and you're sitting there having to provide lots of TLC and adjustments. And you can begin to see the dilemma of why many doctors just kind of throw their hands in the air and they just say, you know what, we're just not doing dentures anymore. This is not worth the time and effort and the headache. And they send them off to whatever the local denture mill is, and they just don't do it anymore. And so the dilemma is that they take forever to fabricate traditionally if you do them the traditional way. The reimbursements are low if you're doing any kind of insurance or Medicaid participation. The lab bills are very high, and again, I don't fault the labs for that. Believe me, I set denture teeth for most of my classmates all through school. I had plenty of wax in my carpet from many a night sitting around watching The Office and setting my classmates' denture teeth. So I get it. They're very labor intensive, and to do them well, it takes a lot of effort, and that comes with a higher lab bill. But it doesn't change the fact that this is still a poorly reimbursed procedure. And then finally, the socioeconomic group in large that needs dentures are usually the least able to pay for them. So, I've heard many a doctor that maybe doesn't have to participate in these programs, or a high-end lab, say, well, just charge what you think you're worth. And that's all fine and good, but honestly, the economics dictate that not every doctor is in that situation, and they can charge what they think they are worth, but that doesn't mean they're going to actually get paid that. Now, in my opinion, digital ought to solve many of these problems. However, the current digital denture solutions have not helped the equation whatsoever. All of the ones that I have seen are even more expensive than traditional workflows with dentures. I've done a few of these with several different systems. They actually took even longer than the traditional workflow, and the lab communication actually got worse during that process. If I was doing things with my local lab, I could pick up the phone and say, hey, let's deal with this and this, and that has just been lost a lot in the digital options that I've tried out to this point in the process. And then finally, and this is the biggest issue for me, is they're all closed format, right? This is how surgical guides used to be prior to a Blue Sky plan, which is you had to purchase a software and then you had to pay for the pleasure of using it every time you did something. And so I just don't like the business model. I want something just like we did with surgical guides, where doctors have the control in their hands, or labs for that matter, have the control to do this procedure, to be able to make these dentures in-house, and to not have to spend a lot of money and overhead to pull that off. And so hence why we wanted to create some digital denture software. Now, I want to start out with just an old school analog case. Those of you who've seen some of my denture duplication stuff have probably seen this case, but I want to show it just because I'm going to build on the techniques that I'm using in this case. So this patient came to me. She was complaining that her teeth didn't seem to fit together right, and they didn't look too good. The existing dentures were 20 plus years old, which is always a red flag. Secondly, she was happy with the tissue fit and borders, another red flag. That's like trying to match the feel of an old worn out hat or an old pair of shoes, just very difficult. And then I saw the patient clinically, and I knew I was in trouble. So here's the situation: classic combination syndrome. The patient has worn these dentures for years and years, and they've kind of worn the teeth down in the posterior. They got into a pseudo class 3 bite, and in order to get the teeth to fit together, you can see that the patient's now in the pseudo class 3. Everything is collapsed. The posterior ridge on the mandible has all resorbed, so this is not an easy situation to treat. Okay, and yet she does want to preserve the tissue fit and the borders of this denture. So what I used to do for expediting this whole denture process, because again, prior to the digital denture options, I still had all the same denture dilemma that I went over initially. And so we were trying to take great efforts to really expedite the fabrication of complete dentures. One of the ways I found to do that was in using duplicate dentures. So we would duplicate the patient's denture chair side. This was typically the first time that we had ever seen them. We would duplicate that denture chair side and then use that as our impression tray. So it's a very good custom impression tray. I would use the Joe Masad laminar multiple viscosity PVS materials to take some really nice master impressions on the first time that I'm seeing them. And so once I have these, typically the workflow would be to send this off to the lab and now have the lab send you some bite rims with wax on them. I always felt that step was a bit unnecessary. And so what I did instead of that is that I would now take these impressions, I would cut back all that excess impression material and add wax directly over the teeth. And what I was doing is creating a chair side bite rim. Now this is great because one, it's cutting out an appointment and a portion of the lab bill to create wax rims. But secondly, this is going to be the best fitting record base that you've ever tried, right? I mean, this is going to have suction because it's just taken out of the mouth. It's as good of a shape as you're possibly going to get. It's engaging undercuts. Whereas if you or the lab has to make a bite rim on a model, they're by necessity going to have to remove undercuts. So the fit is somewhat sloppy. So I'll take this now, cut back the excess material, add some wax, and these now turn into my chair side first visit created bite rims. And so I do all of the same records that you would typically do if the lab had sent you some bite rims or if you had made them. I'm going to make sure that the occlusal plane is parallel to the allotragus. I'm going to make sure that it's parallel to the interpupillary line. And I'm going to open the patient up to the proper VDO where they've got the right facial proportions. And then I'm going to take a bite record there. So I cut some notches in the wax back in this area, manipulate the patient into centric, record the bite with some bite registration paste, and then also mark the midline. And so what I have here is now all of the records that I need to go to completion on this denture. I should say to wax try-in on this denture. And so you can also see the effect of what opening the vertical on this patient had. It brings them back into more of a centric relation. We no longer have that pseudo class 3. And so everything that we need to go to set up is contained in this record, and this is the first time that we've seen this patient. So the lab sent me back the setup for this patient. This was the setup. We tried it in, didn't have to touch it, and so that just had to be processed. And the third appointment, we were able to deliver the final denture. Now, this patient was very excited to get her new teeth. She actually went and got her hair done and just was, really excited to do this. And you can see why. Again, the dentures that she was dealing with previously on the left had caused her to look many years older than she was because of the collapsed vertical dimension. It generated more wrinkles in the face. And you can see these pictures are taken just 20 seconds apart. Take the old dentures out, put the new dentures in, and you can see it made a drastic difference, took years off of her appearance. Okay, so I show you that because there's some of those parts of that technique that I'm going to build upon, because again, my goal in digital is that digital ought to make things less expensive. It ought to make them more efficient and more accurate. Okay, and so we're going to utilize some of these things, and one of the ways that we're going to eliminate some appointments is doing similar techniques to what I just showed there. We'll just digitize certain components of it. So let's look at this patient. This patient's got some existing dentures. They're not a terrible looking denture, but the fit has gotten really loose. They've lost a lot of color, and so he's just due for a new set of dentures. And so what we're going to do with this is, first of all, evaluate the initial setup. So how does it look as far as the smile line? How does it look as far as the occlusal plane? How's the midline? As you can see, the midline is just a little bit off right here. And so we want to be able to correct that with the new set of dentures. And so I'm going to do the exact same thing. If a patient comes to me and they've already got an existing set of dentures, that really makes the whole process much easier, because now those become your impression trays. So a couple of reline impressions inside of that. And then if they're at the right VDO, you just take a bite, and that's your entire record, is what we have right here. Now, whereas I used to have to digitize everything, or I'm sorry, not digitize it, but duplicate it, so that I could pour this up and generate master models and all of these things. If we're going to do this in a pure digital manner, I can now take this back to the lab or use your intraoral scanner and immediately image this and digitize all of this data within 10 minutes or so. And then we can peel out the impression material, give the patient back his existing dentures, and he can go on his merry way until we see him the next day for delivery of the final dentures. So here's what I'm going to do is I'm going to digitize this data. Now we should pause right here and talk about how do you digitize the data so that you have digital master models, digital bite rims, and all those things. So here's what I'm using. Blue Sky Bio sells this. This is the Shining 3D DSEX scanner. This is just a lab scanner. It's about $5,000. Any other lab scanner on the market should work as well. And basically what I do is I call this a model. And so the scanner technically thinks it's scanning a model, but what I'll do is I will image this first. So rubber band these two casts together, and the scanner is essentially going to capture a buccal bite. That's what's going to be used to relate the upper and the lower master models together. And then I'm going to image each of the dentures individually. Now, it's most important that I capture the internal surface of the denture. And because there's not really a good holder that I'm aware of that can hold the denture upright for it to see inside of it, what I do is I just use some triad gel. And so if you see this little pedestal that I've created, think of this almost like a sprue. This is going up and it's connecting to the denture, and the denture is entirely disconnected from the build plate so that this scanner can see the internal of the denture everywhere. And then really I just need to pick up enough of the buccal surface to be able to let the software stitch those models together. Okay, so there's there's three scans with the scanner. One is the buccal bite, and then two is each individual denture / impression, whatever you want to call it. And then using that, the software is then going to relate the upper and the lower model together. You could, depending on how you scanned it, in my scanner, if you called it an impression, the software would automatically reverse that impression, giving you a physical model rather than an inverted model. Or if you just scanned it as a model, you might have to open it up in Mesh Mixer and invert that, meaning basically turn the model inside out. What are the other ways you could do it? You could just as easily use an intraoral scanner. So I've not done this personally, but I've seen, for example, Armin Rezaian do this with a CEREC OmniCam. Dr. Valerie Cooper, I've seen her do this on her Instagram page using the 3Shape scanner. So I think many of these scanners are capable of scanning the interior of the denture to generate the model, and then once again wrap over on the facial surface enough that you capture that buccal data to, one, give you reference for landmarks for setting your teeth, and two, to be able to stitch it with the buccal bite. And so here are the three resulting models that I got from my desktop scanner. I've got the yellow buccal bite, the blue, which is the upper master model, and then the purple, which is the lower master model. So now we're ready to go ahead and start the process of digitally setting these teeth. So one of the things that I think makes our software unique amongst all the other options that I've seen is that you can actually import upper and lower arches of teeth fully set, fully occluded in ideal occlusion, and you can import them all in unison. So other softwares I've done, like if I tried to do this in exocad, I have to basically import a tooth chain and then really tweak it, and then I have to set the full opposing occlusion to it. Whereas with this, my big goal with this was to preset all of the teeth, and that way that portion is done, because anyone who's set denture teeth knows that that's the most time consuming part of the process, is the individual setting of all these teeth. So what I can do is select all of these teeth, import them as a chain, which means that these are going to kind of look like pearls on a chain. They'll be connected together at the contact points, and we can pull that into the case. And so once you do this, you can manipulate the entire chain of teeth, upper and lower, without altering occlusion. So we're going to begin spinning this around using the widgets that are available in Blue Sky Plan, and we're going to orient these teeth between the models. Now, you could be doing that with bite rims, and so if you did this more of a traditional way where you had wax rims, hopefully you set the occlusal plane to ideal, and then you're just going to come and set this occlusal plane of these denture teeth to the same plane. In a case like this, I have that buccal bite as a reference. So I can pull these in, get them approximated, and then I can turn on the buccal bite and I can begin relating those to the occlusal plane of the existing dentures. And if I liked the occlusal plane of those, I can more or less match it. That was the case here. I'm basically matching the occlusal plane. And here I'm looking, if you remember back, there was a bit of a discrepancy on the midline, and so I'm scooting the midline over a little bit compared to where the existing dentures were. And once again, showing that. And so the teeth now are in the final position of where I want them. Now, it's worth mentioning that while I didn't make any individual tooth movements, you absolutely can. So if you want to, let's say, characterize this and maybe put a little slight diastema between number 8 and 9, you can do that. If you wanted to overlap them a little bit, you can do that. If I wanted to move the entire posterior quadrants to shape, to conform more to the shape of the arch. Let's say that the setup is for a normal U-shaped arch and my patient has a very V-shaped arch. I could turn on the tooth chain, lock the teeth where I want them, and then move these teeth in occlusion, the upper and lower, simultaneously to conform to that arch. So it drastically shortens the process of setting the digital denture teeth. And again, here you can see the teeth in between the arches. So now we're ready to begin the process of doing the digital dentures. So in the upper right corner, you'll notice that we have gone into the denture mode. Now this is available, by the way, I don't know if we mentioned this. This beta software is available right now. Michael, I know, has posted a link on the Blue Sky Bio users group Facebook page. And so this is available right now to anyone that wants to try this. I've got a good tutorial video on YouTube that really leads you step by step through this whole process.
And exports are free for the time being, at least.
Yes, exports are free. So get on that while you can. That's a great deal, and that gives you nothing to lose to play with this and kind of get your feet wet in doing this whole digital denture process. So we're going to start the process of making the denture. I've turned the lower model and the teeth off. We're going to do just the upper. And so you see the direction arrow. This is your path of draw, or your axis of insertion. And so right now you see that all the undercuts are going to be the dark brown color. We can reorient this and set more of a path of draw coming in from the front of the mouth and seating like a denture typically would. As you can see, that reduces the undercuts. Now, if I'm going to be printing or milling a definitive denture base, then I want to maintain all those undercuts, right? Soft tissue squishes a little bit. It'll be able to get out of the way, and then I would rather adjust out just enough undercuts manually, chairside with the patient if they can't insert it. But anywhere I can, I want to maintain those undercuts if I'm going to be doing a definitive denture base. So I'm going to turn off the box that says, or I'm going to check the box that says allow undercuts, and I can set how much of an undercut I want to allow. But it's worth mentioning right now, if you were going to do this on some physical models, so let's say that you wanted to just do a printed try-in, well, that printed try-in obviously is going to have to be able to have a path of draw on and off of the master model. And as such, you're going to have to turn off the ability to engage undercuts, because you need to make sure that this thing can go on the model. So we'll click next. And the next thing that we're going to do, if it's a maxillary arch, is we're going to put in the posterior palatal seal. And so you can hold down shift, left click, and the hamular notch on each side, and that's going to create this shape. And then you can fine tune that shape, the depth of it, the arc of it. All of those things can be defined in the slider bars that you see right there. And once you do that, the software is going to generate the posterior palatal seal. And so now we've moved on to the next step, and the software is just going to lead you step by step through the tasks that you need to do to build this denture. So now it's having me draw the curve of the denture outline. Basically, I'm defining the borders of this denture. So you would hold down your shift, you would click, click, click all the way around, define your borders. And then this would be the next thing that pops up. So the software generates based on that curve that you drew. It's going to make a uniform thickness. The default is 3 millimeters, a uniform thickness of pink right over the top of that master model. But as you can see right here, the denture tooth acrylic, or I'm sorry, the denture acrylic or base has not built itself up in between the teeth. And so the step you see right now is defining where would you like the denture to be built up. And so what I do is I try to set this plane to be right about the contact areas of the teeth. And what that's going to do is the software now knows it needs to build the acrylic up in between the teeth to a higher level. It still will not be perfect, but it's going to give you a great head start. So make a note right now of where the denture tooth, or I'm sorry, the denture acrylic is. And then if you look at this, you can see now it's built up higher in between the teeth, and it's thickened the base right underneath the teeth. So at this point, this is where all the artistic ability is going to come in, because we have a rough start, and now you need to go in and festoon this digitally and really make this thing pop. The more time you spend in this step, the more you're going to be able to really make it a denture that stands out from just a basic denture where everything is smooth and flat. Maybe if you're doing an immediate denture and you want a super, super cheap option for the patient, maybe you're going to spend very little time on this step because this is most certainly where you're going to be able to spend the majority of your time. So we'll go in, we can now use all of these various tools. So there's an add and remove. So if I push shift, I can use the add tool and I can use it in various strengths and brush sizes. If I push the control button, it's going to use the remove tool. I can go in and use the smooth or the relax, or I can do the local deform, which is the one I probably use the most. You can use the smooth tool. You can smooth all of this out. And so do you notice here how, whereas previously I had some of the necks of the teeth showing, here I've drug the denture acrylic out. I've covered up the necks of those teeth. I've gone and added a little bit around the gingiva to kind of make a gingival roll. And again, this is where you can spend the most time. So do you see now developing root prominences? I'm using this local deform tool. I'm developing the gingival roll, which is that raised area that follows right around the gingival margin of the tooth. And so knock yourself out, get as fancy as you want. And at this point, we've got the denture basically designed, and the software is ready to proceed and to subtract out the bases. So once you tell the software to proceed and create the denture, what's going to happen is that it's going to now subtract out the socket into which these teeth will fit. So here is the resulting bases. The software is going to generate a whole bunch of STLs. You may have 30 or 40 STLs over here in the deal. But what that is you're going to have some of the teeth that needed to be trimmed. It's going to generate a duplicate tooth there. It's going to give you a base with sockets and a base without sockets. So if you're wanting to make this one big piece that you're going to mill or print as a monolithic structure, then you can do that. Versus if you wanted to use physical denture teeth, you'll be able to print out or mill out just the bases and then bond those teeth in, which is my preferred way of doing it right now. So I've described for you in general how the process works. I like to be able to see it, and so this is a really, really fast, high-speed video of doing this process on that exact case. So if you just watch, you'll kind of see this whole process in action. So here I am importing the teeth, setting them according to the existing dentures. Now we're doing the insertion axis, and now defining the base outline. Okay, we're defining now the base, and now we're doing the digital festooning. So as you can see, I'm using the smooth tool. I'm dragging up with the local deform tool, covering up the necks of those teeth, smoothing it out. And then to generate that gingival roll, that's when I will use the add tool. Okay, so I'll turn up the strength, I'll get a relatively small brush size, and then I go right along the gingival margin, creating a raised area right around the gingival area to make the roll. And then once we do that, hit it with the smooth briefly. You can develop root prominences now, and now I am subtracting the base. Okay, so it's subtracting out the denture tooth STL from the base, which is going to leave me with a final base subtracted. Now, one of the things when you do digital dentures and you've got printed bases and you're going to bond teeth in, so there is a 0.3 millimeter default spacer set between the bottom of the denture tooth and the actual base. Okay, this is the same thing as like your offset in your surgical guides. If you made it a 0 offset, it's going to be very difficult to insert a surgical guide onto the teeth. Well, same thing with denture teeth. If you don't have any spacer whatsoever, it's going to be very difficult to insert the denture tooth into the base. And so there's a tiny bit of slop space, very, very little, but there's some nonetheless. And so there's always the possibility that as you're processing this, you may have a little bit of alteration in the occlusion, just like in conventional processing. So one of the things I did here is I actually just pulled it in a mesh mixer. I have these little articulation pins. I'm happy to share those with anybody that wants to send me an email for them. I can just share with you the Dropbox file. But what these are is these are articulation pins that I can pull in, and it's going to allow me to index the upper and the lower bases together without having teeth. And so what this is, in my opinion, is the equivalent of a digital remount. So, in the old school, Prost, if you were to do a remount when you're delivering dentures, you would capture a bite, and then you would go back into the lab and you would pour up, something to articulate these upper and lower dentures using that bite, and then you would grind in your occlusion and make it nice and perfect and get excursions. Well, this gives you the ability to do the same thing. So you could mount these dentures up in some kind of an articulator, using just this, and then once they've been articulated, pop the teeth in, bond them into place, and then you could come back and now articulate them, check your occlusion, really dial it in if you want to go that geeky. You could also just do a chairside delivery and adjust them like most people do. So here are the bases on the Moonray printer. So the Moonray printer is what I'm using currently to print denture bases. There's a number of printers out there that are capable of doing very nice prints, but one of the things I like about the Moonray is that they've taken a very open source approach to the materials that they'll use. So they have the materials that they have, but then they also have profiles for other materials which they don't manufacture. So for example, the NextDent 3D denture base material, Moonray has a print profile for it. The crown and bridge material, which I'll use in dentures, Moonray has a print for it. So this is the printer that I'm currently recommending. So as you can see, I've oriented these standing straight up. So this is the slowest that they would be able to print. And I'm doing it at 100 micron resolution. I don't really see a huge benefit in going lower than that for something that's soft tissue supported. And you can see it's about a 3-hour print time, and it's going to use 53 milliliters of material. And here's the base material. It's $300 for you know, a bottle of this. And then here are the teeth. So right now in the denture software, the only denture tooth libraries that we have that correspond to real physical denture teeth are the Nobilium denture teeth. These are available for purchase on the Blue Sky website. And as you can see, these are a very affordable economy tooth. And I'm really impressed with the way these things look, especially for $5 a card. So they're a nice tooth. And one of the additional benefits, I think we've got some pictures later on that will show this, but when you're bonding in these physical denture teeth, it's really nice to have some kind of retentive form rather than it just being an exterior smooth surface. And these Nobilium teeth actually have, for example, kind of hole, for lack of a better term, on the underside of the tooth. So there's some built-in retentive features of these. And in addition, they don't come mounted in wax. So a lot of teeth come mounted on a card embedded in wax, and that means now you got to go back and clean all that wax off with alcohol so it didn't, you know, mess up your bond. These are just on a sticky pad that has no wax or residue on it, so you pull it off and that tooth is clean and ready to go. So here is my printed bases straight out of the Moonray. No polishing or anything like that has been done to this point. You can see my articulation pins. If I wanted to go and mount these up on an articulator right now, I could do that. And then once I've done that, you could pop in the teeth here. This is a little out of order. Here is right after bonding in the teeth. I've done no polishing or any kind of festooning or any of that stuff. All I've done is just used the resin, put it into the socket, popped the teeth in, and then cured that. And as you can see, I didn't really change my occlusion much. So even though I didn't do a true remount on this, if those pins were open as compared to right here where they're fully closed, that would be indicative of, you know, some tooth movement that threw the occlusion off ever so slightly. Well, to have no more than just that tiny bit of hairline opening across all of those pins, that's pretty impressive to me. So you can see the lingualized setup here. And then that basically concludes that case. And so I wanted to show you kind of how these teeth fit. And so I just, for the heck of it, wanted to time myself and see how long it would take to set denture teeth in one of these printed bases. Okay, so here we go. This is the video. I'm going to go out on a limb right now and claim myself to be the world record holder in speed denture tooth setting. So I don't know if my video is playing here. Okay, so maybe we can find that later. For whatever reason, that video is not working at the moment. But basically what you would see is that the teeth pop right into that base. It took 1 minute and 17 seconds to be able to set that full arch of teeth. So this is really an efficient way of doing this. You still hear me okay, Michael?
Yeah, hear you okay.
I pulled out a headphone, so I wanted to make sure.
Yeah, now you're not as loud as you were previously, but still audible.
Okay, how about now? Is that better?
Keep on going. I'll let you know.
All right. Yeah, let me know if there's any issues. So one of the things that's going to happen, if you've set any amount of denture teeth, you know that nearly every case, you're going to have some area where those denture teeth are impinging into the cast, right? It's a huge pain in the butt. I can't tell you how much time I spent sitting on the floor of my apartment in dental school, grinding on denture teeth with a Dremel to get them to fit in between the arches. So it's a huge pain in the butt, and it's not a very precise process, right? It's kind of grind at it, see if it fits, grind at it more, see if it fits. Well, with this, you can basically know exactly where the teeth are going to need to be adjusted. And so it's not going to be of that much use to you if the software prints out a base that's got a hole going all the way through it where the tooth was impinging, right? You want to have the smooth tissue interface all through the interior of the denture. So what the software is going to do is it's going to do a cutback on the teeth just where it's necessary. And as you can see, if you look closely at those teeth where they were impinging, the software has created a little bit of an offset between those. That's going to enable the denture base to maintain some material thickness. It'll be very, very thin. If you held it up to a light, you could see right through it, but it's going to allow the base to be completely intact on the internal surface, and it will only adjust the teeth exactly where they need to be adjusted. Now the problem with that is, how do I know where to adjust these teeth? Do I just guess at it and just start grinding on the tooth until it fits into the socket? Well, that's not very precise, and we're trying to get away from this. And so I had the thought, if I under reduced a tooth, my lab would send me a denture tooth reduction coping that I could pop onto the prep, and it would show me exactly where I need to adjust that tooth so that the crown that they've made will fit on there. So we tried to incorporate the same thing into the denture software. You'll have the ability right before you push finalize the denture to check on a box that says denture tooth reduction coping. And if you do that, then the software is going to spit you out an additional STL file that looks like this. This is going to be an STL file it's basically the same base, but anywhere that tooth was impinging, it's just going to allow it. And so you'll have through and through impingements through that denture base. Now, the reason that's good is because now if I print this out, I can take my denture teeth, I can pop them into those sockets, and there still should be a very nice definitive fit. But if I flip this over now, I know anything that's sticking out the underside of that denture represents something that I need to adjust down in order for that tooth to be able to fit back in the socket. And so this is awesome. It really simplifies this, and it makes it much more precise as far as where you're going to adjust. And so the way I do it is I roll out a little hot dog of sticky tack or silly putty or whatever. I make a U shape, and then I flip the denture over and I press that in, and that just keeps some pressure on the teeth from the underside to keep them pushed into the socket. And then I take a burr. The particular burr I use is the hedgehog burr from Parkel. Highly recommend that burr. And I'm going to just go in one big swoop through and adjust all of these teeth in one go. Very quick, very easy to do this. And that's going to reduce my teeth, where now if I take them back to that actual printed base, it can pop right into the socket. All right, so that's kind of a big picture overview of a typical case here. Was there any questions or anything on that before I jump to the next case?
Yeah. How many dentures can you print with one bottle of resin?
Oh, I wish I knew the answer to that. If you look back at that picture I showed, with me printing those articulation pins and the supports, two bases was going to take 53 milliliters of resin. So if you do the math on that, I'm not smart enough to do this math in my head, but work backwards. Those are 1 liter bottles, and you could kind of do the math on what you could expect for the cost of a denture base. I will tell you that I went back and I worked out the complete cost per denture, and on average, it costs about $8 or so to print a base out of that next dent base material, and then you're looking at $10 per arch. To buy the anterior and posterior teeth if you're using those nobilium teeth. So we were up around $16, $17 per arch for the completed denture. That's all in materials cost.
Okay, somebody asked how you could add the denture version into their Blue Sky plan. And Cory had mentioned that the links are in the Blue Sky Bio user group. So you could just go to the group and download the Blue Sky
Right.
Plan version with the Denture module. It's currently a beta release, so it's a separate module from the main Blue Sky Plan install file.
Yeah, it won't overwrite your existing Blue Sky plan. So what you'll do is download that folder, unzip it, and then if you want to use this and play in the beta version, just open that unzipped folder and click on the execute file and just run it as a standalone.
Okay, there's another question: is if there's issues with teeth popping out when you're using the bonding agent for setting the teeth.
Is there issues with it?
Yeah.
So here again, this is a little bit the Wild West right now, and these are some of the questions we've got to figure out. Historically, based on some other digital denture systems, I've heard that there can be issues of teeth popping out because you've got this printed material, which is more akin to a bisacryl or almost like a flowable resin, and then you've got these PMMA denture teeth. And how good is the bond between these? I don't have numbers to throw at you, but I can tell you that I would advise using a bonding agent between them. I'm going to blank right now on the name of it, but Anax Dent has a good material for bonding denture teeth or all kinds of materials, composite to PMMA, PMMA to bisacryl. And so it's a great all-round bonding agent that you can use between this. And in addition, the nice thing about these nobilium teeth is that they have some built-in retention. So there's a lot of mechanical retention. And then furthermore, I go beyond that and I use a high-speed handpiece and I cut some diatorics into the underside of the teeth. So I'm just hedging my bets and assuming maybe there's going to be issues with the tooth popping out, and I'm just taking a shotgun approach and bonding agent, diatorics, all of that stuff. And granted, there's not enough of these out there clinically for me to report back, but the ones I've assisted people on to this point, we've not seen any teeth pop out. So time's going to tell on that. If you went the route of printing the teeth, the printed material in white is essentially the same material as the pink. So you get an incredibly good bond between those. I think you have very, very little chance of those teeth debonding because, again, once they're bonded together, it almost becomes a monolithic piece of composite or acrylic or whatever you want to call it.
Okay, there's a question about a virtual articulator. Is there a virtual articulator to check for excursions?
You tell me, Michael, do we have a virtual articulator coming?
Coming soon. Stay tuned.
Coming soon to a Blue Sky plan near you.
Yep.
And it's pretty darn sweet from what I have played with it so far. So that will be available in everything: denture, crown and bridge module, surgical guide, all that. So, but it's not there yet, to answer your question.
Okay, I think we should keep on moving.
Cool. All right, let's look at another case. This was a patient that I helped another doc out on. So saw the patient just needed a replacement lower denture. They had lost their denture. And so what he did that day was he just took an alginate primary impression of the lower arch. Okay, so that's what you see right here. One of the things I love about this Shining 3D scanner, and it works especially good on edentulous cases, is rather than pouring up the model, I can just simply digitally scan this as an impression, and the software will digitally pour that and make me an awesome master model. Okay, so one of the things, if you're going to scan alginate and a lot of times PBS too, in order for the scanner to see this, since they're somewhat reflective, you need to hit it with some powder. So you could give it a dusting of baby powder, or I have a bunch of old Cerac Optispray from when I was a Ceracer. So I just hit this with some powder to take the gloss off of it, stick it into the scanner, and here I'm just scanning this as an impression. And this is what it generates for me: is I get a nice master model with all the extension and everything. But remember, this was an alginate primary impression. That means it's going to be overextended. And so I'm kind of hacking the software here and using it to generate a master impression tray. So remember when I showed earlier how it will block out undercuts? Not sure if you all can see my mouse, but do you notice this directionality right down in here? You know that this is always where an undercut would be on a mandibular impression. And as you can see, it blocked it out, but it just did it perfectly. No excess block out, no nothing. So what I'm doing right here is I've just told the software I'm going to make a denture, and I'm going through and I'm defining uh, a border to this. And really what I'm doing is I'm just going to generate a base that I can use as a master impression tray. So I'm defining this. I'm leaving it short of the borders because I know I'm going to go in and do border molding with it. That slides out of order, but there, that corresponds to the undercut. So if I pop back here, you see the difference where that dark brown undercut was and where it blocks it out. So sorry, that's out of order. Here's what it generates. Okay, so I have my master impression tray now, and this is going to be an excellent fit. I can 3D print this out, and this is just showing. Do you see the tiny amount of block out? If I was doing this on a physical model, I would just have to throw a bunch of wax down in there, and I would probably end up blocking it out excessively or not blocking out enough and have this thing get stuck on the model if I light cured it or auto cured it. So this was, I did go into Mesh Mixer and just use the inflate tool to pull off a handle. You could just as easily, use some triad gel or whatever and do that physically. Because again, this is a bit of a hack of the software. And so what I'm going to do is just 3D print this out now. And so here is the resulting master impression tray, 3D printed on the Moonray. Fits perfectly back on that primary impression model. And here it is in that patient's mouth. And so what I'm going to do is I'm going to do an impression inside of this now. So just like you would typically do, if you like using compound, use compound. If you like using, a laminar technique, use that, whatever. The cool thing about this software is it does not force you into a workflow. Keep doing whatever you do that you like. If you like to do first visit, alginate impressions, and that's what you make the final denture on, do it. I mean, the workflow doesn't change for any of those things. Okay, so here's the master impression. Now, again, going back to remember my first case where I showed you I would take their denture and I would just add wax right over the top of it. Well, I would do the exact same thing if I was doing, a patient where we didn't have a denture. So in this case, once I've done that impression, I'm going to just go back and take a burr, cut off the handle of that impression tray, and I'm going to cut back all the excess PVS, and I'm going to turn this into a chair side bite round. If a patient came to me and let's say they had no dentures whatsoever, no teeth, and I've got to start from ground zero with nothing, I do the same thing, which is I will use the Joe Masad edentulous impression trays. So those are heat moldable. They give you a bit of customization. I would do master impressions of the patient's arch using the multiple viscosities of PVS to get a first visit master impression. And then I go a step further and I'll cut the tray handle off and I will add wax to the top side of it and make it into an immediate chair side bite round. And again, I get vertical dimension records, master impression, every piece of information that I need to go to finish on this denture, I get after the first appointment. Again, if we're trying to lower overhead and get better results, I think trying to expedite and combine these steps as much as possible is advisable. And then we've got to get some way of recording the vertical. And so the patient had an existing upper, terrible though it was. And so we just did a reline impression inside of that, and then we recorded a bite. Now this, you can see I've added wax, but I did not go to any effort to really establish an occlusal plane or a bite rim on this, because there's a bit of an experiment going on right here. And you'll see in a moment what I'm trying to do. So for all intents and purposes, this is basically a mush bite. Okay, so I've got master impression, upper and lower, and then a mush bite at the right VDO. Here's the scanner again. This is on the Blue Sky website. And so remember, back to how do I digitize this data? What I do is I call it a model rather than an impression, because calling it a model is going to enable me to get the exterior surface and the interior surface, and then I'll just go and invert that in Mesh Mixer. It's up to you. There's a dozen ways to skin this cat, and it just depends on how you want to do it. So I scan them articulated. Remember, rubber band them together, scan them for a buccal bite, and then I will use some triad gel or whatever material you want, sticky tack, it doesn't matter. And I'm just going to try to orient this base where the scanner can see the entire interior of that denture, as well as some of the buccal surface for stitching purposes. And here's the resulting models, perfectly occluded, really detailed tissue models. And so here's what I was trying to do. Remember, I told you that I really didn't generate a good inner arch relationship to establish where to put my occlusal plane and teeth and all, because I was going to intentionally try and see if I could set the teeth into proper position based on nothing more than these edentulous models, really based on nothing more than the maxillary model. And so I've had some experience using the like Staub craniofacial technique. So in the Staub craniofacial technique, you can literally just send in some master impressions and they work some voodoo on it and just send you back a setup. It's incredible. I don't exactly understand how all of it works, but one of the things that they do is that they base the occlusal plane off of what's known as the hip plane, or it's a plane generated by the hamular notches and the incisive papilla, hip. And so that's what you see right here is I'm establishing that plane. It's passing right through the incisive papilla and through both hamular notches. That generates a plane which should be roughly parallel to the occlusal plane. Okay, so I've got that. Now what about midline? I just went right through the incisive papilla and then posteriorly through the mid-palatal suture, and that gave me my midline. And again, this is all experiment. I was just trying this to see if it would work and if I ended up with a good setup. Now, if I turn on his buccal bite of the previous dentures, it looks like I'm still dead on with the midline. The occlusal plane of his old dentures was a reverse smile line. It's kind of all over the place. So we're not using that as a reference at all. So I choose the mold of teeth based on his facial characteristics and the size. There's a lot of different methods for choosing the mold of teeth, but I'm importing those upper and lower arches completely pre-occluded. I pull them in, and the first thing I'm doing is I'm setting this parallel to that hip plane. Okay, so my occlusal plane of the teeth I'm importing is totally parallel to the hip plane. And then how far down do you have it? So that gives you parallelism to the allotragus, to interpupillary, but how far vertically should these teeth be placed within the arches? And so you do have a few references. If you were to look back at that patient's smile, you could reference his existing upper denture and say, well, he doesn't show any teeth at all when he smiles, which tells you automatically you've got to add length. But there's also a number of studies that kind of show different measurements of, okay, for the average distance of the incisors is so far down and so far forward of the incisive papilla. Again, we can use that as an anatomic reference. And so these studies, and there's a bunch of them out there. I didn't include any of them in the presentation, sorry, but look at these studies, and what you're going to come away with is basically a range of so far down and forward of the incisive papilla. And so I do a very scientific approach. I think big person, let's go to the big end of that range. Little person, let's go to the little end of that range. And so that gave me an indication of how far down vertically from the incisive papilla and how far forward of the incisive papilla to put the incisors. All right, so here is my final proposal for tooth positions with this arch of teeth. And now we'll go through the same process. Generate the base. Put the plane at roughly the contact points to tell the software where to build the acrylic up in between the teeth. Generate this. Now begin festooning. Do as much fancy festooning as you like. And now the software is going to give you the bases with the teeth subtracted out. And so here you see that base printed out. Do you notice how paper thin back here on the molars this is? That goes back to the whole principle of the software automatically trimming the teeth where needed. So I don't have a good picture of it, but if you can look back here, you see that these teeth are impinging into the model. So the software is going to trim that, and then it's going to maintain a 0.1, 0.2 thickness of base material so that those teeth will have to be trimmed to fit into these sockets. All right, so now we're bonding teeth in. So you would, if I planned these with the Nobilium T7 teeth and L7 lower anteriors and the 32U and the 32L posteriors, I'm going to just go grab those teeth. I would recommend cutting in some additional retention. Again, you're just trying to hedge your bets to make sure you've got as much retention as possible. Apply bonding agent to the teeth and to the base. And then what I actually use to bond in the teeth is I will just take some of that 3D printed base material still in its wet form, the unprinted form. I put some on a paintbrush and I fill up each of those wells into which the teeth go. I dab it into the little retention holes that I make under the underside of the teeth, and then I push it into the socket and squeeze them together. And then I just hit that with my light curing unit, like the kind you would use for a filling, and that will more or less tack it into place. And then once everything is in, you can go back and do final cures and really spend some time curing everything. But again, I'm just using the exact same printed base material in its liquid form to bond these teeth in. There's the teeth that I used for this, and here was the resulting denture. Now you're probably wondering how I got that so shiny. Well, one of the things that you can do that's kind of cool is anytime you print an object, if you look really closely, you can see the little ridges from the layers of printing material, right? And so to smooth all that out, you could go and pumice it and spend an hour trying to pumice away those little ridges. But what's a lot easier is just take a wet finger, take a finger and stick it in the wet resin and just rub that resin in. It's going to drop into all of those little cracks, and then you hit it with a light curing unit and it will smooth this thing out. You can make glassy smooth appearance to the acrylic here. Now, a little extra tip. So last case I showed you, to analyze the occlusion, we had the digital remounting pins. But suppose that you didn't do that and you just wanted to go straight to delivery. Anytime you deliver a denture, regardless of how you generated it, the problem with checking denture occlusion is that if a patient, let's say that there's a tooth in there that moved a little bit and now there's a prematurity, it's sticking up 0.5 millimeter beyond all the others to prevent a good bite. Is what happens is the patient bites down and then they hit that prematurity. And unlike in natural dentition where everything's fixed together and it stops right there, well, these are just soft tissue borne bases. So the bases just shift a little bit and then the teeth still come together, but it's not really the true bite. And so you end up with these, spots all over the denture from your articulating paper, and you just go arbitrarily and start adjusting on them. Well, one of the things I was taught in a little weekend course forever ago that I took, I think the prosthodontist's name was Nadir Sharifi, is he turned me on to this stuff called occlusal indicator wax. It's made by Kerr. You can get it from pretty much all the big supply houses, but there are these really thin sheets of green wax that are already pre-cut into little rectangles. And what you can do is run those through a flame once or twice, get them soft, and then I just press them over the posterior teeth. And what that does is that now you take this in, the wax is warm, and the patient bites down. And yes, they hit the prematurity, but when they squeeze together, the bite is still supported everywhere else by the wax. And so it doesn't shift out of position like it would if you just had articulating paper in there. So if you look at this, I can look at this wax and now I can read where my prematurities are. I can say, this is a prematurity right here back on the heel. This is a prematurity because it's pressing all the way through and I can see tooth material shining through. Versus this little spot or this spot, you can see there's indentions, but there's not any tooth showing through. This canine, that's a little prematurity. Right here, here, and here, those are prematurities. So it typically takes doing this 2 or 3 times to get me in a really nice equilibrated occlusion where everything is hitting evenly. So I highly recommend this wax. It's cheap. You just, once you've done this and you've adjusted right through the wax, you can peel it off, heat up another little piece, rinse and repeat until the patient feels like their bite is in a good solid position. And here was the result. Now, I want you to remember back how I set these teeth. I didn't generate an occlusal plane with the wax rims. I basically just got a mush bite and then used anatomic references of the maxillary cast to set my tooth position. That was for occlusal plane, that was for incisive position, all of that. And so to be working off nothing more than that information and generate this result, that to me was pretty exciting. Because what that means is that in theory, if you had nothing more than a mush bite to articulate your casts, you could basically go to finish. And so, if you're in a situation where you've got to crank, let's say you're doing a charity event and you've got to crank a massive amount of dentures and do it as efficiently as possible, and having everything 100% perfect is not of the utmost concern. and you can do an awesome job and get really darn close to an ideal result off of nothing more than that information and deliver this result second appointment. All right, there's the dentures in place. And again, the change from initial over to final denture. And just a word about the printing. So if you looked at that previous case, the way I had it printing, you're most often going to have to build supports under the print in order for this to print properly. That means that you're going to have some little nubs that you got to go back and adjust by hand with your handpiece. So sometimes it's nice to be able to print without supports. And so this is something you'll have to jump out into Mesh Mixer. This is not something we want to bloat the program by including in Blue Sky Plan, but you could go around and drag off some vertical components that go down from the border everywhere. That does two things. One, it allows you to lay the model down flat, and two, it allows you to print without supports. And so you're going to have much less final cleaning to do. Basically, you're just going to take this ridge down with a grinder. You won't have any internal supports to clean up. And because they're oriented flat to the bed, it's going to print a lot faster. So this one, I'm printing at 50 micron resolution, and still it's about half the time of how it was when I had them oriented vertically like previous. And so there's the bases, there's the final denture after processing. Again, this is the first picture that you've really seen the intaglio. You can see how thin the base was in the area of all these teeth where they had been trimmed, but there's no perforations through. So we end up with a really nice internal to this denture. All right, I showed that earlier. Any questions on that before I jump to this?
Yeah. In the design of the denture base, can you select zones of the maxilla for less retention for relief zones?
Not currently. So that's something we could look at incorporating. But currently, what I do is I just print it with a 0 offset. If I'm going to make this the definitive base, which is going to get printed or milled, I just make it a completely 0 offset and just build right to that, which is essentially what you would be getting if you did, conventional processing where acrylic is just getting pressed or packed straight to the master model. That's basically what we're doing with the software now. If there's a lot of value in doing that, I haven't looked into that too much, but if there's a lot of value in it, we can certainly incorporate that.
Okay, can you review the best method for setting teeth and curing them with the resin that they're printed with?
Yes. Okay, so first of all, you've got your denture tooth reduction coping. Adjust the teeth wherever they need to be adjusted, and then do a dry fit. Go and take the teeth now and make sure that you can pop all the teeth in that arch and that everything looks like it's sitting properly. So you want to verify that first of all. Once you are clear of that, I would take the teeth out. I would now cut in some retention. So I have a little high-speed handpiece in my lab, and I will just put on a big carbide surgical length burr, and I'll punch, several little holes to create some mechanical retention on the underside of the tooth. Or I can even, hollow out the tooth a bit, put in undercut areas. Again, the idea just being to mechanically retain the tooth. Once I've done that, I'll air blast them out. I have a little steam cleaner I bought off eBay that's real cheap. It works though. You could steam clean the teeth, or you could clean them with alcohol, but basically you just want to get all the oil from your skin off the teeth, and you want to get any of the denture tooth debris from grinding on them off. So you've got the teeth cleaned and primed, you've got the base, hopefully you've cleaned and primed it, and then put on a bonding agent. So I would recommend the stuff from Annex Dent, and I apologize, I can't remember the name of it right now, but I would apply that to the teeth and to the base, and then I would get the 3D printer resin. So what I do is I take that, I shake up the printer resin, and I just pour a little bit into a little Dixie cup. It doesn't take much. Remember, this is, for lack of a better term, your cement between the tooth and the base. So it doesn't take much. And I have a paintbrush, and I'll just take that paintbrush and I'll paint a little into the well of the tooth, stick the tooth in, use the paintbrush to wipe off any excess that may have flowed into the adjacent socket, and then I'll tack cure that into place with just a composite curing light. and proceed around the arch that way until you're done. And then you can go back and really hit it with maybe 10 to 20 seconds per tooth of light.
Okay, somebody commented that it's Bond LC from Annextent.
Bond LC, that's the one.
Another question that came in, can we print a flipper?
Okay, so can you? Yes. Should you? I probably wouldn't recommend it. When I think of flipper, I think of the missing lateral incisor, where it's going to have this tiny little thin piece of acrylic supporting a tooth that's just kind of standing out there in no man's land. I think that would be very prone to breaking. But could you generate the file? Yes. I think what would be more advisable is to perhaps print that out in the form of a try-in, maybe like you see right here, but then hand it off to your lab and let them press in the thermoplastic stuff that they make flexible partials out of that's going to be much less prone to breaking. One thing I'll mention about printed base material, when we do an acrylic base, the traditional workflow, you're going to have the little fiberglass particles in there. PMMA is very shatter resistant. One of the things with the printed resin, while it's got great compressive strength, it is more brittle. And so if you've got some little thin piece hanging out there that's not got much thickness to it, I think you're going to be very prone to that shattering and breaking. So I would just kind of, tread softly there and not make too many promises. It might be worth trying it out and just see how they do. I mean, the upside is if you break it, you can probably print a dozen of them and have plenty of backups.
Okay, let's move on.
Cool. All right. So what I've talked about to this point is just fabricating the final denture in-house. And, because I'm a clinician, I'm always looking for ways how I can do it. I'm warped that way. I love to be able to do everything myself, even sometimes if it's not in the best interest of my own time or money. I just like doing things myself. Doesn't mean I'm against the lab or whatever. It's just kind of how I am. However, I think this is incredibly valuable for the lab to pick up and to do this same workflow, because again, what are they spending all their time doing? And it's grinding on these dadgum teeth and setting them in wax. It's just a very slow and inefficient process. So imagine how much they can speed their whole workflow up if they do that process digitally, or the doctor if they wanted to do it in-house. And so same process. Let's just suppose, though, instead of doing it in the definitive pink base material, that you printed this in clear, or this happens to be gray, whatever shade. I think clear would probably be a good option because it's going to be cheaper than the denture base material, but it will still kind of give a realistic appearance because the gums would shine through. So you would do your digital setup. You would plan out your denture bases, do everything we've shown to this point, but you would just print it in this other material. And rather than bonding the teeth in, get you a sheet of base plate wax, roll it up, and put just a drop of molten wax in each socket and press that tooth into place. That's just going to hold the tooth into place where it doesn't fall out if you hold the base upside down. So here's this, we'll call this our waxed denture tooth setup, or our wax try-in. Okay, let's say that we go to the patient, we try that in, everything's good, or perhaps we adjusted the occlusion a little bit and we're happy now with where things are at. Now you can go and conventionally process this. So remember, if you're going to do this and try to fit it back on a master model like you see me doing right here, it would be imperative that back at the step where you begin developing the bases, that you do not allow undercuts, because if you've got undercuts, there's no way this is going to have a path of draw. And I would also create a bit of an offset space of maybe 0.3, 0.4 between the model and the base to account for any potential shrinkage or inaccuracy or whatever. All right, so we've done the try-in, everything is good. Now we're ready to process this. So if you're a lab or whatever, and let's say you like to do IVO base for your acrylic processing, well, invest this thing up and do your boil out, which in this case, the only thing you'd be boiling out is that little bit of wax sealing the denture down, plus the tiny drop that's holding the teeth in. And then that would allow the teeth to come out. That would allow you to remove the base, because remember, it has no undercuts, and it'll leave you much less cleanup than with the traditional boil out where you got loads of wax being melted down. All right, so let's suppose we waxed down the denture to the master model. We have done any additional festooning and made it as fancy as we want, and now we're going to process this. Now, I have a few different ways of doing processing in-house. I've got an N-Accident large flask. I've shown that on some past webinars. This is a Frick pour flask, and so if you're using the pour technique, this is a very affordable option. You can buy all of the stuff that you need to be able to process in-house via the pour technique for probably 200 bucks total, materials and everything. And really, once you've got that, all you need is a pressure pot. Okay, so I've put the sealed up model down into the Frick flask. And now what we'll do is begin using the reversible hydrocolloid. So this is some stuff that you just heat it up to its melting point, and it's like a liquid that you would pour in, and it captures detail very, very well. Again, I'm a redneck, and I fully admit to it. I went and bought a little crock pot at Walmart. So this was a $20 crock pot. That's what I heat up my reversible hydrocolloid with. Works great. And then I can pour that off into the flask. And so once you've done this, you've filled it up to completion, you've overfilled it, then you'll just set this aside and allow that auger to cool down until it's solid. Okay, so this is not as fast of a technique as printing necessarily, but it's still very efficient. All right, so my auger is cooled down, everything is solidified, and now I can disassemble the flask. I can remove the bungs right here. I can now take a little knife and tease out my master model. All right, so tease out the model, and that leaves you this. This is your investment. Now take this over to your boil out tank or just to some hot water. Since this is just one drop of wax in each tooth, you could just pop these things out by finger and then use a steam cleaner to remove all the wax. But you're going to now do your boil out, or the equivalent of the boil out. That's going to soften the wax. You'll be able to take off your printed base. And once you've done that and you've cleaned off the wax from your teeth, you've cleaned them with alcohol, everything's ready to go. Now you can put your teeth back into the investment. Okay, so the teeth are going to index back into these spots very, very accurately. Now you've got to have some holes to pour your acrylic into. And so this particular kit comes with these sprue formers, and these just push right through that auger, creating a hole. And there's a small, medium, and large, and you can see they pull out a little plug of that auger, leaving you vent holes and a pour hole. All right, so when we close the flask back up, we've got now basically all the teeth in there, and everywhere where the gray base had been, the area between the auger and the model is now going to be a void or a negative space in which you can pour the acrylic. All right, this is a great picture showing the underside of those teeth. Do you see how the teeth have some retention kind of built into their shape? These are those nobilium teeth. And then it would be wise, again, to go and put some more mechanical retention in with the handpiece. Close the flask back up, put it back together, and then mix up the acrylic according to manufacturer specifications. There's a number of good pour acrylics, and you'll pour that in nice and smooth until it begins extruding out of the vent holes, which are the ones on the right and the left-hand side. So that goes into a pressure pot. You allow that to harden for about 20 to 30 minutes. And when you take this out, this is going to be like deflasking a traditionally processed denture. You're going to have your sprues, which are the little portions sticking up there. That will have to be cut off. You'll have a tiny bit of flash around the edges, again, very easily smoothed off. But this is a very intimate fit. It's going to replicate exactly how whatever anatomy you had on the master model, because this is processed directly to the master model. All right, I left a picture out here showing the buccal view of it. But again, this is the equivalent of doing your traditionally processed denture. So do whatever workflow you like. If you like IVO-based, do it IVO-based. If you like to pack and press, do pack and press. If you like to do the pour technique, do the pour technique. If you like the microwave flask, It doesn't matter. Don't get hung up on just thinking this is printed dentures. This is any workflow that you want to do. It's just purely giving you a much more efficient way to get to the end product. Okay. All right. Any questions on that? In the home stretch.
Just a comment. Mondial Teeth would be a good addition to the software. They have a nice diatorics in them. Did I pronounce that correctly?
Yeah, Dentures.
Okay.
Yeah, let me say a word on that. So right now, if you go download the beta, you're going to see that the only physical denture teeth that we have available right now are the nobilium teeth, and we've only got 3 molds in particular right now of those nobilium teeth. Now, I know everybody's got their favorite pet brand of teeth. The Mondial teeth are nice. There's many, many nice denture teeth, and I know everyone wants to be able to use their preferred method. The trouble with that is, to do that legitimately, we need the manufacturers to submit their libraries. So I'm certain there's some manufacturers listening in on this right now. They're trying to see what's going to come of it. Here's the deal. Every manufacturer is scared to death to give up their STLs because they think, well, they're just going to rip us off and hack this and go mill or print our teeth. And yeah, I guess that's a reasonable concern, but we are going to take every effort to protect the STLs. So if you play with this beta, you're going to see that when you get to the end, you'll be able to export the teeth, the bases, basically any STL in the software. So I could see a company being concerned about giving up their STLs. One of the things we're working on right now is splitting the workflow. So there's sometimes that you're going to want to do this base and the teeth, and perhaps you do want to mill them. Well, we're going to give you that option, but we're not going to give you the option to do it with the manufacturer's teeth, because we want to respect them. We want to protect their product and not allow everybody to basically cut them out of the picture. We want to work with all these companies to make it a win for everyone. So what it will do, if you opt to go down the road of printing or milling the teeth, you just won't have the manufacturer's teeth, but you're going to have some amazing tooth libraries available to you. So I've been having I just got 2 libraries actually today. I've got a couple of amazing libraries from Mitch Hurst, incredibly talented ceramist up in Idaho. I've got a library from Dave Veach over in the UK, very talented guy. I've got a number of these coming from different people. And if you're a lab tech listening right now and you would like to submit a cool library of teeth, send it on. We'll put it in there and you can have a tooth library named after you, and people will be able to use these teeth for crown and bridge, for dentures, for all of these things, and they can print and mill those things to their heart's content. However, if they choose to go the route of doing physical denture teeth, then when they go that route, they'll be able to, of course, plan it using the STLs. But when it comes to the point of exporting, they'll only be able to export the denture tooth reduction coping and the bases, but not the teeth. And that's going to protect those manufacturers' teeth. So why did I say all that? I wasted a lot of breath on that because I want any manufacturers listening to know that this is only a win for you if you include your teeth in this library. We're not trying to lock this down and make this a proprietary thing where you can only use whatever such and such tooth that we sell. We want everyone to be able to use whatever tooth that they want, and it is going to help you sell teeth because this is just a much more efficient way of setting them up. And then if they're going to be able to use that file, they've got to be able to, they're not going to be able to get the STLs out otherwise. So they've got to purchase the teeth for conventional processing. So if you have a pet denture tooth you like, start bugging the powers that be to submit their libraries to Blue Sky, and we'll do our best to incorporate those. That was the longest answer ever, Michael. Sorry.
No problem. Okay, let's go on.
All right. So that's basically it for the routine cases. I just wanted to show you a few of the out there possibilities of some things that are, going to be coming down the line. And so I've shown some cases online of doing 3D printed hybrids and things like that. So right now, I'm sure if you've done hybrids, it's a very costly lab bill to be able to be able to have some kind of a temporary restoration to deliver right after you do, let's say, an all-on-4 procedure, right? And again, no fault of the lab. It's intensive to make that, very time and material intensive. So we want to be able for the lab or the doctor to be able to set these teeth to generate the digital try-in or hybrid or whatever, and then to be able to 3D print or mill that thing out, and that creates their temporary restoration. And you'll actually very soon be able to do even the final restoration in Blue Sky Plan. So this happens to be a little temporary hybrid that was generated in ExoCAD, actually. And the reason I'm showing it is the principle's the same, whether you design this in ExoCAD or in Blue Sky Plan, but you can print this out of a monolithic material. So in this case, it happens to be NextDent's new micro-hybrid composite printed material. So historically, the only crown and bridge material that we had from NextDent was a shade A30, and it was really dark. I think they've done a great job with some of these new MFH materials that are coming out of creating nicer shades. So this happens to be a bleach shade. And as you can see, I didn't have any festooning done on this one because the goal was to go back and add some gingival material, because this is monolithic, right? It's kind of ugly if it looks like all one big white piece. And so I like the Anax Dent materials. This is using their instrumentation and their gingival composites. And so what you can do now is you can go back and characterize this and pimp out the gums. So you can use the red tinted composite down in the lower area, which is going to typically be redder. You can use the lighter colored composite going up into the embrasures and creating that gingival roll. And this was the result. This was literally the very first time I ever used this material and got this result. And I'm not some superstar lab guy, so I think that says a lot for the quality of the materials and the look that you can achieve. Now, is this as pretty as layered ceramic? Absolutely not. But remember, this is for a temporary application, and this costs literally nothing but the cost of the materials. Okay, so whatever amount of material I printed, and then whatever amount of gingival composite I used. I think that's a really cool way to do this. And this is what it looked like in the mouth. The patient wanted white, and they got white. Looks really nice. What about a monolithic printed denture? And so after we did that case, I had the idea, well, why not do that as the entire denture? So someone earlier asked about the question about, do we have to worry about popping teeth out? Well, it remains to be seen whether or not we doing the traditional teeth. But man, if you do it this way, you're not going to be popping a tooth out. This is that same NextDent MFH microhybrid material. And what I did is I just exported the entire denture, base, teeth, everything. These happen to be the one of the sets of Mitch Hurst teeth. And so you can see this really beautiful, nice anatomy that's in them. I used that library of teeth because I'm running an alpha version that isn't publicly available yet. And so I've generated a full contour monolithic denture and then 3D printed this thing out. Here it is. I know I put supports internal. This was what I was talking about earlier. If you print with supports and you have the intaglio oriented toward the print bed, you're going to have to go in and clean up all these little resin tags. This is a demo case, so I don't care. All right, so again, nice looking denture, nice looking teeth shapes and everything, but it's monolithic. And so what I did from there is went back and used the Anax Dent materials. And so I used the red to basically paint everything and block it out. So a thin wash of the red gingival material gave it its overall pink color. And then I go back, and do you see the gingival roll I'm developing there? This was using the Anax Dent dark pink flow. And so I literally just took it and I ran a bead of it all around the teeth, right at the necks. It's a pretty good stiffness to the material, and so it will maintain that thickness without spreading and thinning itself out. And so it's beginning to take shape now. I took a little thin endo file and drug it up into the embrasures to extend this peak. That's how I got that. And now going back with the translucent pink over the top of all that. And so you can see this is starting to look like a much more lifelike gingiva. Now the teeth are monolithic. That's the only downside as far as I can see with this technique is inherently, if you're printing the teeth, they're going to all be one shade, one consistency through and through. So you are giving up a little bit on the aesthetics as far as translucency, unless you went in and added staining and cut back or whatever like that. But the trade-off is you're getting a monolithic denture, and this stuff is strong. I've actually, used this stuff quite a bit, and unlike the other resins, which tend to be much more brittle, this stuff is very stout. I've dropped this on the floor a time or two, and it didn't break. So it's very promising material. And so we could do that. Imagine if your patient comes in and you could just, within the time it takes to run the printer, you could print them out dentures. You could just add on the gingival composite. Again, I told you that other case was the very first case I ever did with gingival composite. This is the second. Again, I'm no master with this stuff, but I think it's a decent result. And with any amount of practice, I think we could get where this is predictable to have a super nice result. And so imagine charging, who knows, $300-400 for this, and it's your economy denture. And yes, the patient understands that there's not translucency built in. But listen, I've had some lab techs recently get mad at me over posting this stuff because they say it's lowering the quality of care or whatever. And what I want to say to them is, listen, the problem in the world right now is that the problem is not that we don't have fancy enough dentures, right? There's some technicians showing out of this world quality stuff, dentures that will blow you away. But the reality is they're charging $1,000 for that. And remember Dr. Doe at the beginning, he only gets paid $700, and there's no way that makes sense. So the problem is not right now that we don't have good quality dentures available. We've got that. We've got to go the other direction and expand towards the direction of having more options available that can be generated more efficiently at a lower cost so that our patients can have options more within their budget. And if they want to do the amazing detailed translucent denture using the fanciest teeth out there, that option is there, and it has been there. But now we have another option for the mom of three who, had her teeth all knocked out and she's got to get the denture and she's struggling to feed the kids. This is something that will be in the realm of possibility for even that person. And really that's where my efforts are focused on. Nothing wrong with the rest, but I'm trying to figure out how can we make this stuff more affordable, more accessible. So this to me is really exciting, and I think it's a very promising technique. Going even further beyond that, this was a printed hybrid. So do you notice how here I've printed out of two materials? I've printed the pink base. You also see that the holes are subtracted out for the pickup. And so if you're doing this case guided, you know where the implants are going to end up. And if you've pre-planned out the restoration on the front end, you know where the implants are going to emerge out of it. So you can already have holes generated to do your pickup and your conversion. And then furthermore, we're going to generate a path of draw tool within the next build where you'll be able to take a full horseshoe of printed or milled teeth and drop them in one motion. So check this out. Just take this thing and not even individually setting these, just drops right into place, bond that together, and it's game over. This is a denture or a hybrid temporary that you could generate in just a few minutes for very affordably, and it's just a really cool option to have. Okay, and then just going beyond that, the ability to do this, you've got again a bone level surgical guide, and everybody now is going nuts and paying these enormous lab fees to do stuff where there's bone supported guides and then a bone supported temporary restoration so that it drops into place right in the place it's supposed to be. Well, I got news for you. You can do the exact same thing within Blue Sky Plan. So up here you see a denture that was generated in Blue Sky Plan. On the bottom, what this is a bone tray, and then it's got the digital hybrid, which was designed here, and they're connected together with sacrificial supports. You see these tiny little supports? So this indexes itself onto the bone, into occlusion, into the right position. You could do your pickup, because if you could see this, there's already holes pre-made. Here we go, where the implants are going to emerge. And so you index this into place, you do your pickup, you reshape the underside, and then you cut those sacrificial supports, and the patient is off to the races. And this costs just a few dollars to generate all of this. And then beyond that, there's just so many possibilities. I wish I had 3 more hours to talk to you about some of this stuff, but I'm gonna just give you a taste. This is an all-on-3 case, right? It's the new trend. Everybody's going to be doing all-on-3 next. Or it could just be that I was too cheap to put another analog in there and make an all-on-4 model. But nonetheless, principle's the same. Let's say that you put your implants in, and here's where your cylinders are emerging. I can now either intraorally or extraorally on a model image this, and I can now take a piece of pink base plate wax, squish it over the top of these cylinders. And then this is something that we're selling now at Blue Sky Bio. This is called Trilor arch bars. They're made by BioLaurin. Best I can tell you of what this is made out of is kryptonite. This stuff is indestructible. It's ridiculous. It comes in 3, 5, and 7 millimeter thicknesses, and they're just shaped to these horseshoe shapes, kind of like an arch would be. So what I can do is, here I've taken out a 3 millimeter thickness of this, and that little template I just made by pressing on the cylinders, I lay that onto the arch bar, I stick the pencil through it, and I'll mark those cylinder positions. Here they are. I can now generate some holes, and so this is chairside trimmable. It's impossible to break, but it's very much machinable with your high-speed handpiece or with the lab burr. And what I've done now is created the pickup holes so that I can pick up all the cylinders. And then just using a pencil, you can outline the shape of the bar you want to create. So we're making a chairside fabricated bar. Here's the final bar shape. Pick this up in resin cement or composite acrylic, whatever material you want to use. And here is my final bar, picked up chairside, and this was generated in 10 minutes. This takes no time. I know this is not a patient, but just pretend this is the patient and you just did all that chairside in the mouth. Now here's where it gets really crazy. You can now image that, pull it into Blue Sky Plan, design a denture right over the top of it. So remember the blockout function? If I block out undercuts, now it's blocked out all these undercuts right here. Here's the base with the teeth subtracted. I'm going to print out, here's the underside of it. So it's going to fit right on top of the bar and have a path of draw. So here's what I've done is I've printed the base material out of NextDent base. It's still on the supports. And then I also printed the teeth themselves out of the NextDent crown and bridge material. Bonded those together, and this is now, for all purposes, a monolithic denture, even though it's 2 different materials. Remember, these are similar materials, composite, chemical makeup, and so these have an incredible bond to one another. I've really tried to pop one of these teeth out, and I cannot do it. You'll break the entire denture first. All right, and here's the underside of it. So this was just designed as a conventional denture. You can see it now seating fully on the model. So again, let's pretend this is your patient, and now let's pick this bar up in the mouth. Put you some long screws into those access holes and make sure that you've got access to them through the top of the denture. And now just use chairside acrylic and do a pickup. You see how now the pickup has been done and that bar is encased in acrylic? You'll probably have a couple of little spots that you'll need to go back and salt and pepper in to make this smooth on the underside. And then once you've done that, this is like a chairside conversion. You can cut away the flanges, and here you see basically a converted printed hybrid. But even though it's thin in profile, this has that Trilor bar incorporated internally into this. Here's what it looks like now on the underside. It's smooth, it's cleansable. And here's what it looks like on the top side, minimal finishing done. And here is the result. Now, this is a friend of mine and a classmate from dental school. He practices right down the road. So at the last course, I gave this to him. This is Dr. Garrett Orr. Hey, Garrett. And I asked him, I said, Garrett, see if you can break this thing. Now, Garrett is not a small feller. He's been known to get after it. So let's see if Garrett can break this restoration. Are you able to hear that sound, Michael?
No.
Okay, I'm going to narrate it here. So what I'm asking Garrett to do is I'm asking Garrett to take this very thin restoration, the one you see in the picture, and just to see if he can break it. Okay. And so this is not thick. Like, this is actually violating the typical restorative guidelines. Like, most people say you need to have 15 to 18 millimeters of vertical space for a hybrid. This is violating that. This is much short of that. It's probably at 12 millimeters. And I'm going to have Garrett now give it all he's got and see if he can break this thing. All right, so he's trying the old two-hand squeeze on there, no dice. And now he's going to try to pull the sides apart. Oh, wait, first we got the two-hand squeeze again. And now he's going to try to pull the pieces apart like a wishbone. Still can't do it. This is just 3D printed material, but it's got that tri-lure in there. So it allows us to leverage the ease and the cost efficiency of doing things 3D printed, but incorporating a chairside technique to make this thing nearly indestructible. And so I think this has possibilities as a definitive long-term restoration, especially if we use that MFH material. As long as the color stability is good, there ain't no way that the patient is going to be able to break this. So I've taken this to my last probably 8 courses, probably 300 plus people. No one has been able to break it to this point, not just Garrett. So I'm not picking on just him. This stuff is indestructible. So it's a really, really cool option. And I'm going to stop at that. So one thing I will say, we are going to do an inaugural Blue Sky Bio digital denture course. It's at my place here in Winchester, Tennessee, which is, you've probably never heard of Winchester, but it's right near where they make all the good Tennessee whiskeys, Jack Daniels, George Dickel. So it's a neat place to visit. We're doing this course intentionally in the summer because I live on a lake, so there's going to be lots of extracurricular stuff going on the lake. There will probably be a lot of Tennessee whiskey involved and lots of good food. So we would love to have you come join us for this. I just opened registration yesterday. About half of the spots are gone already. So if you're interested in doing this, I would move quick. I've only got room for 24. And you can find the registration link for that course at coryglenn.org. But that's it for me. I can answer some questions now, Michael, and then we can wrap it up.
Okay. Let me just remind everybody, while everybody's still there, to complete the webinar attendance form so we could send you those CE credits. That's important if you want to get those CE credits. There are a lot of comments going back and forth. A lot of people have been answering other questions from other users. Baron's been great as well, jumping in with a lot of information.
Oh, Baron joined us, huh?
Yep. Yeah, we have a great turnout today from many different countries.
Cool.
For those tripod supports, what software do I need for those to hold the VDO?
Those were, I did it in Mesh Mixer, so I'm sure you could use a number of CAD programs, but I just use Mesh Mixer because I'm comfortable in that program and it's free. So like I said, if you'll send me an email or contact me through coryglenn.org, I'm happy to give those out.
There's been a bunch of requests to get the files for the pins in order to hold articulation in place. Maybe you could post it to the Facebook group.
Okay, let me do that instead. I'm going to post those onto the Blue Sky Bio Facebook users group, and it'll be a Dropbox link, and then y'all can have them and knock yourself out with them.
Okay. A lot of comments coming in with thank yous for the software. Thank you for the presentation. Game changing. Very informative. So, I think at this point we'll wrap things up. Cory, thank you very much as always. And the form for the CE, I'll post the link again in the chat box. Let's wrap up with one more question that just came in. Can the tri-lure be used, polished, and tapered to create a removable interim, as well as splinting the implants to create a hygienic solution?
You could absolutely use it to splint implants, and I can't imagine anything stronger. I mean, I'm not kidding you. This stuff is near indestructible. I've whittled this stuff down to incredibly thin dimensions and not been able to break it. So it is an amazing all-around solution. If you have a mill, you can do it in the puck form and mill out, full frameworks. I know people are using this like many people would do a peak framework. You can do a tri-lure framework. It can be exposed in the mouth. It can be polished incredibly well. It's just a really cool material. But having it in that arch bar form where it's already pre-shaped and it's chair side machinable, to me is a game changer. That's a really nice option.
Okay. This is being recorded and will be available via the Blue Sky Bio website and available via YouTube as well. So if anybody wants to watch it again or forward it to somebody else, then those possibilities exist as well. So Cory, more comments coming in. Thanks so much for the presentation. Great job. So thank you very much, Cory, and thank you everybody for attending. And we hope to see you at other presentations coming soon.
All right, thanks.